Hello, my name is Joseph Sanchez, and now we'll be doing a presentation on the biomedical information pill concept. So what is a biomedical information pill? It's a pill that provides patients and doctors with health information through the pill, or in the case that we'll discuss further, a sensor on a pill. So what could be the benefits? On the top of my head, I can see patients being more aware of their overall health, doctors having an easier job when assessing patient health and treatments going forward. And what could be the harms? Harms could be more questions about the possible harms come to mind, such as who controls the information, how accessible is the information, and other privacy concerns that we'll discuss further in the presentation. So one medication, let me just move this out of the way. So one medication that has actually been approved by the FDA as of 2017 is Abilify MySight. It's an existing biomedical information pill system, and it is mainly used to measure how accurately a patient is following medical treatment, such as their intake of certain pills, and trying to improve the issues of inaccurate use of medication, since I believe the New York Times noted that inaccurate taking of medication, via like pills, costs about $100 million annually to the healthcare system. So how does MySight work? MySight works by having a sensor on the pill, and then when the pill is taken, it makes contact with stomach acids, and the sensor then sends an electrical signal to a patch that's located on the left rib, and the information on the left rib will then communicate with a smartphone application, noting that the patient did take that pill at that time. And then patients can then put their mood following a couple hours after taking the pill to see how they feel. If they're feeling nauseous, they can put that they're feeling nauseous. If they feel good, they can put that they're feeling good, and so on and so forth. And information can be sent to the doctors to assess the information, such as doctor's visits, or if there's a general, I'm sure patients can call generally just to see what's going on, and the doctor will be able to obtain that information. So, is it ethical? So, before starting a concept or pushing it into production, we should ask, can we do this rather than should we? That's the first question. So, using utilitarian ethics, we can see if it's ethical or not, as we will in the coming slides. And if it is ethical, then we should proceed. Otherwise, we should just stop and try to go forward with a different concept. So, what is utilitarianism? It's mainly the question of does the good outweigh the bad? And in this case, we have to see what are the benefits and what are the harms. And like I said before, if it's ethical, continue. If it's not, then stop. So, what are the benefits? One of the benefits is that it's an efficient way to incentivize patients to take their medication, such as the language learning applications such as Duolingo, Rosetta Stone. They have systems such as rewards and points that can encourage patients to keep taking their pills. And they can improve well being in society with proper medical treatment. Because I'm sure the $100 million isn't just a monetary amount, there are also intangible consequences to society because of their health. And it assists doctors in providing accurate treatment going forward. So I'm not a doctor, but I'd imagine if a patient inaccurately takes medication, then if the doctor prescribes another treatment plan going forward, that treatment plan could be affected by the previous inaccurate uh, taking of the pills. So, and what are the harms? There can be a possibility that an unwelcome third party assesses patient data accesses patient data illegally, such as hackers. And that would be very concerning because health information is very protected, especially in the United States. And manipulation on the patch of the left rib. So a hacker group could take the functionality of the patch and cause some harm. The type, I don't know, but people can be creative. So, under what conditions would it be ethical? So, if the application is made with safety in mind, no software is 100% safe, but if it's really a concern, then it'll mostly be okay. My apologies. Clinical trials, if they show positive results, and then we can move forward knowing that it's effective. And if many people can access the technology, because residents in the United States can't be the only ones being able to have access to this. So let's look at the FDA study. The FDA had a sample size of about 81,400 in this study, in which they tested the technology on an experimental group and a control group. And those groups each had schizophrenic patients, patients suffering from bipolar disorder, and major depressive disorder. Because the company, Abilify MySet is a sub-technology of that company, but Abilify does make a pill medication for those suffering from mental illness, so that's why it was used on that specific demographic. And the trial results show that schizophrenic patients had about a 30% less relapse rate. Bipolar patients had about 20% less. And fortunately, major depressive patients had no major difference, but given that, we can move forward and try to improve that. And here we see the graph. Here is the control group, and here at the bottom is the experimental group. You'll see that the experimental group has a much lower relapse rate than this one up here. Higher means higher relapse rate. Same thing with this. This is for bipolar patients. Experimental group is down here, and control group is up here. Now let's look at the global obstacles. The main issue globally is the use of smartphones, because in order to use the technology, the patch on the left rib needs to be able to communicate with a smartphone app. So we need to look at the amount of smartphone users worldwide, if it's enough to be considered accessible by most people in the world, and the standards that we need to keep in order to have it consistent globally. So about 45.04% of the world has a smartphone, which is about 3.5 billion people. It's not 50% just yet, but every year it does increase by a bit. And 3.5 billion people is a lot, considering certain countries have a lot of governmental restrictions, such as North Korea. It would be very hard to get the technology to North Korea. But it's a very good starting point. And the number grows year by year. This is the graph by Statistica. I'll just move this here really quickly. As you can see, it grows up year by year. 2020 is the second to last one at 3.5 billion. The numbers on the top represent billions. And I'm sure we can reach the halfway marker eventually. And according to the ACM, the Association for Computing Machinery, the four that are most important to me, but all the code of ethics should be considered, is be fair and take action, not to discriminate, respect privacy, honor confidentiality, and I'll move this here, design and implement systems that are robustly and usably secure. Because in order for this to work globally, there needs to be a emphasis on consistency worldwide with these standards. So in conclusion, Abilify MySet is a step forward in healthcare technology, because it would save on that $100 million a year and inaccurate treatment. It is shown to be an ethical concept in terms of utilitarian ethics, and if standards are followed, it could help patients everywhere. As we saw, year by year, it grows, so eventually it will reach a good portion of the world. All right, I believe that is it, and thank you for your time.